Let's be real. Nursing school is 90% learning a new language and 10% figuring out how to survive on zero sleep.
I'm Nurse Mia, and in this video, we are speed running the essential vocabulary for oral and esophageal disorders.
Ever open a med search chapter, see all the bolded terms and feel lost before reading the first line? Key terms are just a small part of the work, but they unlock the rest. If you learn term first, the rest becomes easier to absorb. Chapter 56, Coordinating Care for Patients with Oral and Esophageal Disorders. This is part 1, the key terms. In this video, we're going to have also some pictures at the end that explain a little bit better the key terms. But first, let's go to definition one by one. So the first one is Barrett's esophagus, a condition where the normal squamous lining of the esophagus changes to columnar epithelium, often from chronic GERD, increasing cancer risk. So think as a Barrett, it's like a bad change in esophagus lining. Next, it's candidiasis. It's a fungal infection caused by Candida species, often affecting the mouth, oral thrush, or esophagus. So think about candy grows fungus, candidiasis. So candy. And you take the candy and you enjoy. Oh my Lord, my dog. Oops, I had to pause. Dysphagia, difficulty articulating words due to problems with muscle control related to speech. So this means like not there. So atria, it's like atria articulation issue. Dysphagia, it's difficulty swallowing. So phagia is like eating. So it's a eating swallowing problem. Erythroplakia. Erythro, it's like red. So it's red patches in the mouth that may be precancerous. So erythro is red, and plakia, it's like plaque. Plakia, plaque, it's a plaque, a patch. Gastroesophageal junction, the area where the esophagus meets the stomach. So think about junction, it's like a meeting point. And keep in mind here, it's important spot where the reflux happens. I will show you a picture about it. Esophageal reflux disease, it's a chronic backflow of stomach contents into esophagus because that junction doesn't close properly and it's inflamed. So backflow, it's the reflux. Gastropoexy, it's a surgical fixation of the stomach to the abdominal wall. Pexy, it's like fixation. Herniorrhaphy, Herniorrhaphy. It's a surgical repair of hernia. It's like sewing, like sewing repair. That it's the raphy. So Hernioctomy, it's a surgical removal of hernial sac. Tomy, it's like cutting out. Leukoplakia, it's a think about leukocytes. So there white patches in the mouth that may be precancerous. Leuko is white and plakia it's the patch. And earlier we had the red patches here, erythroplakia, and here it's leukoplakia. I'm going to get down a little bit the screen and lower esophageal sphincter, muscular ring at the esophagus stomach junction that prevents reflex. So it's like a lock esophagus shunt. Mallory Weill syndrome, tear of gastroesophageal junction mucosa, often from severe vomiting or retching. So Mallory is like a tear after vomiting. Odynophagia, it's a painful swallowing. Earlier we have difficulty, and this is the painful. Sialorrhea, excessive saliva production. Sialo, it's a saliva, and rhea, it's like a flow. So this and rhea is like flow. It's excessive saliva production. The squamous cell carcinoma, cancer from squamous cells, common in oral activity and esophagus. Squamous is like a flat cell. Stomatitis, it's inflammation of the mouth lining. Stoma, think like a mouth, and itis is inflammation. Stricture, it's a abnormal narrowing of a body passage, such as at the esophagus. Strict, think about narrow, so strict. Supradiaphragmatic volvulus, twisting of the stomach above the diaphragm. So the volvulus is a twist, and in outline you learn why. Trismus, inability to open the mouth fully due to muscle spasm. So it's like a lockjaw, like a locker. Lockjaw, it's a tight mouth. Xerostomia, it's a dry mouth. from reduced saliva production. So xero, it's like a dry. Stomia, it's the mouth. So dry mouth. And now we go to watch some pictures regarding those key terms. As I mentioned earlier, here it's a compare and contrast of medical terms, and dysphagia with odynophagia. One is pain and one is difficulty swallowing. Stomatitis is the inflammation of the mouth, so it's oral. For the exam, it's called mucositis, which is common in chemo patients up to 40%. Painful red swollen makes eating very difficult. Also, we mentioned the xerostomia and Sialorrhea. So one is excessive salivation. When I said the Sialo, it's a saliva, and Rhea, the flow. And the xerostomia, the xero, it's the dry. And Trismus, it's like the lockjaw, it's difficulty to open the mouth. And I have another 2 more slides to show for key terms. We started the key terms with Barrett esophagus. So it's the condition where the normal squamous lining of the esophagus changes to columnar epithelium, often from chronic GERD, increasing in cancer risk. So the Barrett, it's a bad change in esophagus lining. And here you see the acid reflux, how that opening there. And then the hiatal hernia with the type 1 and type 2, where it's the twitching, the twist, the supradiaphragmatic volvulus twisting of the stomach above the diagram. You see it there. And the surgical fix, when I say like a swelling, the Herniorrhaphy. And you see, I hope these pictures make it easier to understand the key terms. Lastly, we have the Leukoplakia and the Erythroplakia, between leuco, the white, and then the red, red patches. So you can see in this. And then we have the Mallory-Winn syndrome. It's when I said the tear of gastroesophageal junction mucosa, often from severe vomiting or retching. So it's the Mallory, it's a tear after vomiting. So that's it for this chapter as regarding key terms, and I will see you in the outline. Thank you for watching. Like and subscribe. Bye for now.